So, welcome to the podcast. We're in sunny Wales, which is quite unusual. And
Very sunny.
welcome, Chris.
Hello.
So, brief intro, Chris. Tell us about yourself.
Yep, so I am Dr. Chris Jordan. I live and work in Scotland across a couple of different practices. I'm a general dentist who, over the last few years, has kind of narrowed himself down to kind of complex ortho restorative treatment and now down to orthodontics only. My start of orthodontics came from Ian, so here I am, and travelled down now to have a bit of a chat.
Okay, brilliant. So, you've told us briefly about your history and how you've started. So, what you're aiming for? Where you're aiming to get?
Good question. So, yeah, if we go back to kind of where I started, so I graduated from my undergraduate in 2017.
Okay.
So what's that? Eight years.
Yeah, 8 years.
8 years.
Right.
I know. And kind of did the usual. I moved and did my vocational training, and then went into working in NHS practice. Realised very quickly that wasn't really for me. I remember the moment I realised it wasn't for me.
Yeah. Wasn't doing a class 2 MOT,
no,
was it?
It was. I'd finished the day in practice and I'd seen 45 patients in one day, and got to the end of the day. We'd actually, from some bizarre reason, managed to only finish 10 minutes late. I don't know how that happened, and then realised that I hadn't written a single note.
Yeah.
Because you were so, constantly trying to keep up, and then so I never left the practice that day, despite finishing work at 6:10. I didn't leave until 9:45.
Yeah.
Writing notes, and I was just like, this is not how I need to live my life at all.
No.
So I left NHS practice after only a couple of years and moved into fully private practice, working for a corporate that their whole ethos was kind of bringing up young dentists who wanted to get out of NHS practice and into doing the work that they wanted to do. So it was really good. They upfronted some funding for me, let me get on courses, let me learn and grow, and then that's where we met.
Right.
That's
the diploma course.
Yes.
Yeah.
So on the ACE diploma ortho course, I did restorative diploma at the same time. I did lot of different things all at the same time, my sedation training and hypnotherapy training and loads of things, and then from there I've just kind of moved and worked in different moved from corporate to an independent private practice, and just as time's going on I was taking on more and more complex treatment, but I found that my passion was always coming back to the ortho.
Shuffling the teeth.
Shuffling the teeth. Obviously, as you know, more than shuffling teeth.
Well, I mean, it's just plain Tetris, isn't it?
Yeah.
It's not that complicated.
The shuffling teeth's not that complicated. I would say that the people are complicated.
Oh, yeah, I mean, that's like everything, isn't it? Like the staff, management of people, how can I put it, as the boys would say, the persuasion and influence skills you need to acquire to
so
get them to the end.
Yeah, so I've now at the point where I've kind of all form of kind of general dentistry has now fallen away from my everyday life, and I'm fully focused on ortho now, and just getting better and better and learning more and more from kind of everybody. So back to your question of kind of where I want to go, I think the deep answer, easy answer is to just be the best version of me.
Yeah. And it's almost like you've got there, so it's just becoming more entrenched and more evolved, so to speak.
Kind of just in that, I suppose, reputation building phase of, I feel like I've gathered a lot of knowledge, and it's really now in the trenches of putting it all into practice and doing what I need to do.
Now, just jumping back to persuasion and influence, you recently completed an early interceptive course with clear aligners.
Yeah.
Now, okay, we've got the conventional interceptive measures, pushing teeth over the bite, reducing the overjet. I always found it. I know where we're going to go because everything's moving to airway, but I always found it very difficult to manage youngsters, as in 7-8-year-olds.
Mm-hmm.
So let's just focus on that. So can you tell us more about this, Stefan? Because Stefan, has been a key opinion leader for lingual. He's been around for donkey's years. He is a master of his craft. So tell us more about this interceptive treatment with aligners and how you manage the compliance, and what sort of things do you do with this early treatment?
Yeah, so I think the best place to start with that is probably the actual course itself, I would say. I've done a lot of education.
Oh yeah, you've done
a lot of education in my time.
Yeah.
Stefan joked at one point, I'm the most educated dentist he's ever met. But the course itself is it's built around, I suppose, a lot of emotion and a lot of things that are, once you see it, you can't unsee it.
Yeah.
And Stefan, as a trainer, I think you're almost like 10 steps behind where he is. He's so passionate and he's got so much information, and you're trying to just pick the bits that you can kind of grab onto the coattails and get kind of what you need. But from other than, I would say, the diploma course I did with you, I would say this has probably been the most professionally changing course that I've ever done. Because obviously with yourself, it was me kind of deciding like what direction do I want to go with my dentistry, and made the decision to go down the ortho road. But with Stefan's course, I would say it was very much taking what I knew about ortho and expanding on that and kind of growing on it, and picking up on things that are becoming, they're not new. I mean, if you go back and read even textbooks, the Prophet textbook, or back to Angle, or any of those, they all mention mouth breathing and growing, and so it's not brand new, but just being able to pick up things, around tongue ties and cross bites and mouth breathing and development and lack of oxygen and all these things that are becoming much more prominent in the world, I would say. Don't know if you agree, but much more.
Totally, because I'm trying to remember, it must be 10 years ago when I did Sphere on airway, and we weren't allowed to say mouth taping.
Yeah.
Whereas now, it's on the radio, you mouth tape.
Professional athletes training with mouth tape.
Well, again, Gianni Gugno, going back to cycling, used to do that, and he was world champion from Italy. And Patrick McGowan with his books, and I say the radio, Chris Evans, it's becoming more. And the functionals, we used to use Frankels. But it was the management of the patient that was the problem, because they're big appliances. And it was pushing water uphill.
Then I think so. I think one of the main things I took away was I think the whole, you're not 12 yet, so we'll not bother. We'll wait until you're 12.
Well, that's the NHS system, isn't it?
And I think it was kind of really spinning that on its head more than anything. So, I have patients that I see now from 4, 5, 6, 7 upwards, and I think there's 2 points to come into that. Number one, you see things after doing that course. I see things and I say, if we do nothing, because doing nothing is always an option, isn't it? You can always,
keeps the GDC happy.
No one's gonna drop dead because you've not intervened with an ortho treatment at 5 years old. It's just fact. But whenever you see things, you say, well, if we do nothing, I know that this is probably going to happen. So I know you're crowded at 5, 6 years old. Your primary teeth are crowded. We know if your primary teeth are crowded, was it 95% chance of severe adult teeth crowding. So I know that if we do nothing, you'll at 12 go and see an NHS orthodontist, and they will say, right, well, we need to take 4 premolars out now because we need to make room, because you've got too many teeth for your mouth.
Exactly.
Which no one has too many teeth for their mouth, they've just got too small a jaw. You can argue that point if you want to. But you see things, and I think then coming back to the appliances, what child wants to wear a twin block?
Oh, yeah.
Or a Frankel?
Yeah.
Or something that harder and they can't do anything.
Yeah.
With a clear aligner, it's discreet,
Yeah.
it's smaller,
Yeah.
it's comfortable.
Yeah.
I've treated myself with
Yeah.
clear
No,
aligners,
totally agree.
so
Yeah.
they are comfortable. If you put higher trim lines on them, they don't need attachments,
No.
so the kids don't have these things rubbing against them when they're reading.
Yeah.
You can build in functional devices like, I mean, there's companies
Yeah, we
here
see
today,
yeah.
lip bumpers, habit breakers, mandibular advancement blocks like
Yeah.
twin blocks. All those things can be built into a comfortable appliance.
Yeah.
So
Yeah.
if you get kids on board with what you're trying to do, make it fun, do what you're going to do. I personally have not had any problem with compliance in kids, and I actually find compliance is significantly better than whenever they get to teenagers, because then they're a nightmare.
I suppose they're getting, they know
It's
better.
not cool anymore.
Yeah. So, I mean, we touched on this when we were discussing it sort of in the trade show. The way you word your consent, and also brings me on to the next question, what tech are you using in Ortho to help with that compliance, and how do you word the consent form, for want of a blunt instrument?
So I've come at consent forms and things, I suppose, a little bit differently than your kind of standard, well, this is the treatment, here's your risks, here's your benefits, sign or don't sign. But I've tried to turn my whole sphere of orthodontic treatment into a partnership with patients. So, it's not me doing something to you, it's you coming in wanting something, me helping you to achieve that goal, and we work together and we get to the end. If you do your bit, I'll do my bit. If you don't want to do your bit, then I don't want to do my bit. And it's worked really, really well, actually, and not just, kid patients who, let's be realistic, don't really know if they're signing up to a partnership. Their parents know, and their parents will say, okay, I'll work with you, you work with me, we'll get to the end. But with adult patients who, are maybe, they're maybe flagging behind, or there's something going wrong, the simple comes down to, if you don't want to put the effort in, I don't want to put the effort in. So, and they want me to put all of me into their case, so I want them to put everything into it. Because at the end of the day, if with clear aligners, I mean, it's maybe slightly different with a fixed brace, because the fixed brace is always doing what you want it to do, as long as you're making the right adjustments. But with clear aligners, if you don't wear them, they don't work. It's kind of as simple as that.
I must admit, that's why I sort of went down the lingual big time, because maybe I've just got control issues. But I know there's compliance, and it's interesting as well looking at it with a different hat on. I mean, looking at the boys, as I call them, they go on about rapport is one of the most useful tools they learn. I mean, not just how to fire the Glocks, the SIGs and all of that, it's rapport. And I think that's the problem. I've certainly noticed with the way the practice I'm at the moment is heavily gone into NHS, and I'm just looking at, this is all transactional. You did this to me and I pay you this money. And I think that's where the problem with certainly dentistry comes in. It is a relationship business.
100%.
And being able to develop that rapport.
Because you asked me about technology. So I'm a huge advocate of dental monitoring, and the many things that dental monitoring can bring to a case. It's not just about kind of big brother watching you and making sure you're doing things. If that's part of my consent, is that they sign up to say, my part of this is that I'm going to take scans every week. So they take the scans every week. I review their scans every week. I see the pictures. I know what's going on with their case. We keep up on it. But I send through that. They can message through the direct messaging service on DM, knowing that they're going to get someone from the team, be it myself or our treatment coordinator, get back to them in a reasonable amount of time. If they've got concerns, they can take pictures of things and send them in. It's not taking up time in the chair for them to have to come in to me to look at it and go, oh, that's just, you've just bent a little bit of your aligner. Let's just,
Yeah.
easy things. With I use quite a lot of self-ligating brackets.
Yeah.
Little doors popped open.
Mm.
Could you just put your finger and press that? Done. Fixed. Hasn't been an appointment for them to come into the diary.
No.
But then you also get the other side of that where you can record an update video, so you can
Yeah.
get side-by-side scans of how the patient's treatment's going,
Yeah.
and you can then send them an update video with your face in it saying, and they know then you have sat and looked.
Yeah, Big Brother. Well, not Big Brother as in AI's watching,
No, but you
human
have
touch.
taken the care to
Yeah.
look at their case
Yeah.
and say, hi Frank, amazing, look at how
Mm.
well this tooth is moving. I'm seeing this one's maybe not quite doing what I want it to do, so
Yeah.
what I want you to do is use some more chewies with your aligners here, or
Yeah.
let's see how this goes for another 2 weeks,
Mm.
and if it's not playing ball, then we'll get you in and we'll sort it
Well,
out.
that's really, because I think my concern, and I'm quite happy to tell dental monitoring, is that they're promoting it as, look how much time we're saving you in surgery, which is fine. But the flip coin is that time in surgery is also used for developing rapport, because it's a biological system. Things will go wrong. And if it's a transactional approach and things go wrong, they want recompense. So being able, having charisma to develop rapport, doing the videos, I think they need to push or promote that, not just look how much time we've saved you. Because the patients, from a medical legal point of view, I know the cases coming in, it's like, I've paid this much money and I don't even see the clinician. I see them once every 6 months because of this monitoring. So I think the balance is between, it's like everything, the truth is in the middle.
I think for me, I mean, I've spoken to the dental monitoring guys a lot and discussed, I think the problem is that some clinicians take it as I don't need to do anything with them now.
Yeah.
I've fitted my case, you're on dental monitoring.
Yeah.
The nurse
Here's 50 aligners. Bye.
The nurse is monitoring it, or the
Yeah.
treatment coordinator is monitoring, so they don't actually look at it at
No.
any point. And I know a lot of practices that work that way.
Yeah.
And they maybe only call the clinician if they think, something doesn't look right here.
Yeah.
But at the end of it all, you can have the best nurses and best treatment coordinators in the world. They're still, they aren't the ones moving the teeth.
You're the one carrying the can.
Carrying the can, yeah. So for me, it's not that I'm a control freak, it's just that I think that I should be involved in that process, and them knowing that I'm checking it builds that rapport. They know, because I send them messages to say, you're doing so well, it's going really well, treatment's moving the way we want it to.
Yeah.
And for me, I find that really useful. I mean, coming back to kind of even just sending videos, so whenever I do a consultation with patients now, I pull everything together and do a little presentation, and I use Loom. You're a big fan of Loom.
Yeah.
And I record them a little presentation, going through their case, talking them through asymmetries and intraoral photos and scans and x-rays, because I want them to understand what's going on. Because if they understand what's going on, they understand why I'm trying to do it, and why I'm trying to treat them and what I'm trying to do.
Yeah, and again, I mean, a couple of points on that is people buy people, and if you've gone to that much length and time to look at the detail compared to a high street specialist, shall we say, oh, you need upper fours, upper lower fixed. Hang on a minute, why would I go to you when you've spent all that detail? I'm going to come to you and not him. So, yeah, and also from a medical legal point of view, that is music to my ears, because the number of times the clinical records are just not fit for purpose, and I've had to phone up the defence union like, I can't defend this case, just pay out. So the more you give, or the more you have in your database, shall we say, the easier are to defend. So
because it's not even just the videos. Like oftentimes, and I think we think the clinical notes are sacrosanct, and you write and you write things in it, and they go, but the patient said you didn't say that.
Well, it's interesting because the barristers are like, as long as it says discuss, and I'm like, well, just because it says discuss doesn't mean it happened. And then the GDC said, well, we have to have a signed signed form, consent. So already we've got GDC and barristers potentially arguing.
I mean, part of
but consent is
the conversation.
Yeah.
I mean, the part of the Loom videos is that, and I say it in all the videos, is if you have any questions about anything that I've said in this video, comment on this video. It's like a YouTube video.
Yeah.
Comment on. Only you have access to it. So
Yeah.
you write all your questions in, and I will answer. Everything that they've asked and my answers can all be copied and pasted.
Exactly, and it's there.
And it's all together.
Yeah, and you've got a audit trail that they've opened it and seen it, so they can't say they haven't. So yeah. Well, I would say the last question, maybe, what would you give your younger self? But as a young whippersnapper, what would you give? One piece of advice would you give to a younger person setting out?
So I mean, I think different talking to myself, because I know that by being and me and who I am, I've ended up here. So I probably wouldn't give myself advice as such. But if I was giving someone else advice, I think my advice would always be just be curious.
Yeah.
Ask questions. You can learn something from everyone.
Yeah.
Every person that you speak to, every conversation, there is something that you can.
And it's
take
not
from
just
that.
in dentistry either.
No, 100%.
Yeah.
Even people that you disagree with wholeheartedly in every possible way, I can guarantee you, if you actually listen to what they're saying, there's something in there that you can pick up and say, that's interesting, And if you go into a conversation and go into life thinking, I want to absorb as much as I possibly can from this, and you treat people with respect and kindness, it all comes back to you. People appreciate your time, they appreciate you listening to them, and they are more likely, not just from a selfish point of view, but they're more likely to want to help you out and say, you've sat and listened to what I had to say. I may not agree with your points, but we can have a dialogue.
It's like that. Everybody wants to learn presentation skills and how to speak and stuff, but nobody wants to learn how to listen.
No.
Active listening, and you get so much information for free just by learning.
100%. And I just think if you take that one bit of advice and say, every opportunity is a learning opportunity. You never know everything. And even if you are, I don't know who'll be watching this, but even if you are the head consultant of the head hospital in the whole of planet Earth, and you're speaking to the janitor or speaking to the cleaner, don't talk down, don't speak to them as if they don't know anything, because I can guarantee you know a lot about this, you know nothing about this.
Again, I mean, I've been so heavily influenced by the Special Forces guys. Be humble, and how they talk. There is no hierarchy. Everyone is equal. And how they talk to someone in the hotel is exactly the same, because you just never know what little nugget of information you're going to get.
100%.
So, So with that, thanks very much, Chris. Just a wee little gift to keep you busy, because I know you've gone down the plastic plaque. So
I still do a bit of lingual.
Just try to encourage you back to the wired side.
What have we got?
And attention to detail.
Oh wow! Did you wrap this?
Yeah.
Every bit of tape.
But the attention to detail comes to what's inside, because we like our kit, and we like the best kit.
We do like our kit.
It will just tear, so we've just got 3M.
Oh.
I'm not saying 3M adhesive, that's no good. Transbond's very good if anyone's listening.
Oh wow, is this the instrument kit? Oh amazing, thank you so much. Oh, that is so kind, thank you so much. Amazing.
Well, you've got to open it, you daft bugger. Oh God, I need just lingual. Allegedly.
Oh, there we go. There we go. Is there one on the other
It's
side?
not rocket science, mate.
It's
not like
rocket science. Oh, amazing.
So it's not
Not going to fall apart.
It's
when I
Hugh
start using it.
Freely.
Amazing. Thank you so
It's
much.
the best of the best.
That is so kind of you. Thank you.
Well, I
so
know you
much.
work at different places, so you get used to bending with a bird beak, and a Hugh Freely bird beak, and a Hugh Freely wire cutter is not going to let you down.
No, amazing.
So,
Thank
yeah.
you so much. That's amazing. Perfect.
So
Thank you for
try to keep you on the straight and narrow.
and for the viewers, say, when I started my ortho journey, I didn't know anything, and you are the reason that I'm here. So thank you very much.
So those voices in your head
are still you, Ian.
Oh,
still
dear.
your voice in my head.
Unlucky.
Thank you so
All
much.
right, brilliant.
Amazing.
Cheers. Thanks
Thank
very much,
you.
Chris.
Cheers.
Cheers. Thanks.